Hello, everyone. Welcome. We're going to go ahead and get started. Thank you for joining us for today's webinar. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We are based at the Tulane University School of Public Health and Tropical Medicine, and we are sponsored by the Robert Wood Johnson Foundation. In today's webinar, we're going to tackle something that people in health-related fields try to avoid or shy away from. Though many public health agencies uplift the aims and principles of health equity, efforts towards these goals face a critical challenge: politics. People and organizations working to address health equity must confront and navigate political structures, contexts, and barriers that can be opposed to this work. Even within the field of public health, differences in views and beliefs can stymie efforts to address health and health inequity. This webinar will bring together voices from healthcare advocacy and public health fields to share their insights on the role of politics in the advancement of health equity. Speakers will discuss ways that organizations across sectors can collaboratively participate in the political process and bridge political gaps to push for policies and programs that will improve health outcomes for all. So before we hear from our panel, though, we want to hear from you. You all have valuable opinions and insights on health equity, and we want those to drive today's conversation. We will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code 67794323. So I'm going to do that since we're all in this together. I'm going to menti.com and I'm putting in this code 67794323. If you are more technologically advanced, you probably scan the QR code on your screen. Okay, so once you're in, you can give us a thumbs up to let us know that you are there. Awesome, I'm seeing several thumbs up. Okay, cool. So I think we can go to the next screen to ask the question for the group. Okay. The question says, in your opinion, how do politics impact health equity? So you can take some time, respond to that question. You can shoot off your first thoughts, or you can spend some time to think about your responses. You can also submit more than one response. So I'm going to do the same thing. Okay, in your opinion, how do politics impact health equity? Okay, so every which way, I appreciate that phrase. In every way, politics drives resources. Yeah, politics is all about power and resources. It is the I assume, number one factor that there are health equity. So the reason why we have health equities is because of politics. Quite a bit. How do they not? Yes. Excellent response. Access to care and services. How does politics not impact health equity? It's the main reason we're here. Allocation of resources, too much. Okay. Someone says politics stymie health equity. I appreciate you using the word stymie, which I used before. It may be financially beneficial to certain parties. Yeah, very interesting to think about the role of finances and money in politics and how it can therefore impact health equity. Politics impacts the policymakers from all areas. Yeah, thanks. You can continue to respond to that question, but we'll ask the next question. What role do you believe politics should play in addressing health disparities? Okay, we see someone with the same response, and I agree. And what role do you believe politics should play in addressing health disparities? All right. All right, you can respond to that. I'm doing the same thing, giving my response. And you can also respond multiple times to this. This is a way for us to really just ideate about this topic, for us to bring what you all are thinking as the audience to the panel, and really incorporate, whether you're a member of our collaborative or not, incorporate your thoughts and ideas about this topic, because this is what this collaborative is for. So what role do you believe politics should play in addressing health disparities? Bolster support, be the #1 driver in making changes in all of the roles. We need funding to dismantle them, or maybe eradicate is better. Should be the answer in a just system, but it isn't because ... Okay. It is the cause, then it is also the answer. Real change comes through policies first. Okay, interesting. Structural repair and dismantling of upstream barriers. Awesome. Provide access to resources, protecting and advocating for stakeholders, funding, creating policies that aim to reduce disparities and promote equitable outcomes. Okay, I'm really listening to these responses. Thank you all for contributing them. Like I said, I'm actually going to ask the panelists to respond to what you all said. We are extremely excited to have you all here. Thank you for being here and for collaborating with us in even talking about this topic. You can continue to share your thoughts and comments in the chat throughout today's discussion. You can also ask questions through the chat or the Q&A box. Additionally, you can join this conversation with your questions and comments beyond this webinar on Twitter by using the hashtag partners4HE. So we're going to move on and introduce our panel. We have some very distinguished guests here, and I'm excited to have them all. First, we have Philip Alberti, who is the founding director of the AAMC Center for Health Justice and senior director of Health Equity Research and Policy at the Association of American Medical Colleges. Philip, welcome.
Thank you, Karen. So excited to be here.
Yeah, we're excited to have you. Yeah, awesome. Next, we have Ella Green Moten, who is the president of the American Public Health Association. Ella, welcome. Oh, you're muted.
Sorry. Thank you. Glad to be here. Making mistakes already.
No, it's okay. Awesome. Thank you so much. And lastly, we have Anique Forrester, who is the Chief Diversity, Equity, and Inclusion Officer in the Department of Psychiatry at the University of Maryland School of Public Health. Welcome, Anique.
Thank you for having me.
Awesome. Thank you so much. Thank you for being here. First, I wanted to ask you if you had any top of mind responses or anything that stood out to you in those poll questions or the responses to those poll questions that we saw.
On mine, with many of the sentiments that were expressed, it makes sense. And health equity is tied up in everything.
Yeah.
Same thing, and politics tied up in everything.
Right. Yeah, okay. I was struck by something that we discussed last month in our webinar, advocacy, and how that is a part of politics, but we'll get to that in a minute. I wanted to ask you all each, in your opinion, what role does politics play in health? I think we can start with Anique. I think it would be interesting to hear from you first. What role does politics play in health?
Yeah, I think it's important to kind of think about that health is something that really affects everything about a person's life. And so politics sets up the structures that determine how we live. And many of us may or may not know that one of the biggest determinants of your health is your zip code. And so the services that are available to you, what your environment looks like, the safety of where you live, all of that is tied up in ultimately what health conditions you may deal with, how bad they are, and your ability to access care for them. So politics is the center of all of that. It's the sort of main way that we set up the systems and structures that ultimately determine people's health.
Ella, how do you think about that? What role does politics play in health for you?
So when I started to think about the question itself, and as I always do, I have to go back and get a definition, because we throw the term politics around. I don't know if I've ever looked at a real definition of it to know exactly what it's supposed to mean, whether it lives up to its meaning or not. But even pulling up that definition and seeing that it's a set of activities that are associated with making decisions, it's like, right, and that's exactly what happens with health. Those decisions, those political decisions, cause all kinds of havoc with health for all of us, right? It's just it's like a rippling effect. And if you don't really think about it, you might think of politics as just this thing that sits over there in the corner and does nothing. But politics, it involves it captures everything. Yeah, I agree with Anik.
I love that, and I thank you for grounding us in that definition, right, of the business of making decisions, because there's capital P politics and the federal level, the state level, there's lowercase p politics at our organizations, and all of these decision makers, right, impact our health. And I think for me, I'll switch to policy for a sec, right? All policy is health policy for me. It all contributes to health or detracts from health. And I think in 2024, like every policy is hyper politicized, hyper political, hyper polarized, to use that phrase. And so whether we're talking about kind of organizational, local, state, or federal politics, they're a major driver toward or distractor from our health. And it comes down, I'm sure we'll talk a lot about power, but who are the voices, who are the folks that are really having influence over those decisions at all levels. And I think that's where the impact on health, and particularly health inequity, when certain voices are intentionally absent from that decision-making table, to use Ella's definition. So I'm excited to dive into this.
I was literally going to ask the same question, but replace health with health inequities. So if you could, any of you, give your thoughts about how politics impacts health inequities.
When I think about health inequities, it's the thing that politics actually create. Politics create the inequities, inequities. And so until we even think about these and identify those and give it a name, give them a name, I don't think we'll ever be able to address equity. We have to know what the inequities are in communities.
Well, I was going to say that as a physician, part of what I see is the consequence of the inequities. It's really people's death rates and their sort of rates of contracting illnesses that maybe are preventable or treatable. And so there are real life consequences for healthcare inequities, which are set up again in the systems as we've discussed. But on the sort of day-to-day patient care side of it, you see people dying where they don't need to die, or not being treated for illnesses that are relatively treatable because they can't access care, because it's unequal, it's inequitable in how that care is provided to them. So I think about the real world aspects of inequities every day.
I came up in the school of thought that certain social factors, like all the isms and phobias, classism, racism, sexism, homophobia, those are fundamental causes of disease, right? Fundamental causes of inequities, because they work their way into what Daniel Dawes and others would call political determinants of health, right? The decisions we make or don't make that kind of unjustly, inequitably distribute all the vital conditions that we all need to thrive across our communities, who has it and who doesn't. And so when I think about the way that politics, gets into our bones and into our blood to create these inequities, we don't have to look very far in 2024.
Right.
Right? I think about laws like don't say gay. So I'm a gay man. Right? I see a law in states as don't say gay. That is literally intentionally making sure that my community does not have an equal opportunity for safety, or an equal opportunity to get health care, or an equal opportunity to be in a space and just feel relaxed, to feel not stressed, right? The politics is explicitly removing my fair and just opportunity for health. And that's just one of many examples, sadly, that we can point to, and the direct connection between how policies through politics kind of impact population health in really unfair ways
Mhm.
today.
Thank you. I think that was like public health 101, 102, right? We asked the basic question, how does politics impact health? Cool. How does it impact health inequities? Yes.
Yeah.
Next. And the reason why we're here is how do we as individuals, as members of communities, as people with jobs or positions related to health or health equity, whichever phrase you want to go with, how do we use politics? Not, we talked about basically what we put out is how do we think about politics here, but how do we use politics to get to our goals of health equity? That, for me, that's the question that we have to get to. We have to answer that. What do you all think about that?
So I've been really taken with this shift away from thinking about social determinants of health to thinking about vital conditions for health, right? So instead of saying we're going to address housing, we want every community to have humane housing. Or instead of saying we're going to address transportation, we want every community to have reliable transportation. If you've seen this, Google vital conditions for health, and you'll see this beautiful framework. And at the center of the framework, at the center of these vital conditions and basic services that all communities need to thrive, the very center, the core, is civic muscle and belonging, right?
Mm.
It was not a surprise to me when the CDC came out just today or yesterday with their recent BRFSS data and said the most significant health-related social need or social determinant across all communities is social isolation, right?
Mm.
We've lost that civic muscle. We've lost that connection to each other, that kind of connection that builds movements, right? The kind of connection that builds movements across communities, across diverse socio-demographic communities, where we can find that common ground and that common framing that all of us benefit when all of us have those just and fair opportunities for health. It is not some Robin Hood social justice or Robin Hood health justice where I've got to steal it from over here and give it to over here. There's no zero-sum game. And so I think the goal, I think a goal of health justice for our centers to really think about how we build movements, how we build diverse movements, where that civic muscle is flexed to kind of demand from our politics and our politicians that we are passing laws, we are thinking about practices that really explicitly create health opportunity for communities who are voiceless, powerless, who are not at that table, at that decision-making table, to go back to Ella's definition today. So I think it's for all of us to participate in and drive politics in the direction that we think collectively it needs to go.
Right. And I think it also makes us understand and really know that it's not just the folk who we think of as being in those political positions. It's all of us. We all have a responsibility to be part of the movement, to join the movement. We have a voice, right? And something more importantly, most of us have hope where we can speak loud and clear on what needs to happen in our communities and use those votes, use our voice to hold the politicians accountable for the actions that they take or the actions that they don't take. So being putting ourselves in a position where we are informed and understanding that we have a responsibility to be part of this
And for me, I think about using politics by getting people to realize how sort of not unattainable it is to engage with something that you feel passionately about. I think people think of politics as being this big, broad thing, but really a lot of people who get into advocacy work are focused on one or two key issues. And so advocacy is really showing your public support for something, to engage with other people that sort of have the same level of concern or interest that you have in that particular thing. And so for me, I think about like encouraging individuals to really take onus, really look within their sphere of influence and advocate for things that are critical, and then build on that advocacy to larger political aims in order to get things done. So people always kind of think too big, and I always encourage people to think individually and then within their, again, sphere of influence.
On that point, Anik, I know this audience, I'm guessing, is a big public health audience, big population health audience. I often reflect on my time in graduate school in public health. Like, I was never introduced to the Federal Register, right? Where federal agencies are asking for input from you, from folks on this webinar. What is your expertise? What do you have to say about this proposal? There are ways to your point exactly, that each of us as individuals, even in small ways, signing on to a letter, submitting your own comments, voting, right? I mean, these are things that we can all do from the comfort of our own home and desk. And so, yes, we can be out there and be social justice warriors, advocating, marching. That's one way to do it, to build that civic muscle. But we, with the skills that you all have on this webinar, the scientific skills, the policy skills, the history skills, the lived experience skills, can be contributing actively to regulations, legislation, kind of what's coming down the pike. So I really appreciate that point, Anik.
And another point before we leave this area, I think in terms of how the American Public Health Association is able to contribute, the fact that they are in Washington, that staffers go to the Hill regularly to voice our voices on the Hill, advocating for us. The fact that Dr. Georges Benjamin takes on so many issues, but advocating for the public's health. I think it's important to know that this organization is definitely an organization that is advocating for the health of the public.
I have a follow-up question. One is from one of our participants, an audience member. The other is from me. And I'll ask the question from the audience member first, because my question is actually about TikTok, which we'll get into. But this audience member asked, the politics of health, or states rather, the politics of health is vote for your health and healthcare. A push is necessary to add this to the checklist for politicians. Where do they stand? You all are, at least in this capacity, representing organizations. How does that show up, or how does that work in thinking about politics and voting and supporting politicians or policies? What happens for you there?
So I can speak for myself as a psychiatrist. So part of what we try to like really focus on are, in terms of the Department of Psychiatry, are things that affect people with mental illness very broadly, and trying to figure out how to engage with our politicians. Here at the University of Maryland, we have a very close relationship with the state, and a lot of our funding comes from our state. And so we have some of our trainees and some of our faculty who work with like representatives in the state assembly to craft policy bills and things like that that affect people with mental health issues, and funding for programming and treatment for people with mental health issues. So I think politically, you have to kind of look at your environment, the climate within the organization. Sometimes you need to advocate for changes and engagement around issues if they're not being engaged with. Sometimes you just need to get involved if it's already going on, like it is in my department. And then you can expand from there. But I think that people need to like just really be aware based on their organization or the things that they're interested in, what is actually happening, and then get involved.
And I can say from the American Public Health Association's point, um, there are state affiliates that are connected with the American Public Health Association. So there are 52 state and regional affiliates, and each of these affiliates would do on work in those states as it relates to the different health issues, and voting would be some of those, as well as the American Public Health Association has um, a long history of advocating for us to vote, because when we are actually hoping to um, provide the funding that organizations like the American Public Health Association and the other organizations, we're helping to push that funding through. Oftentimes, some of the bad actors who are engaged in politics are not on the same page. They're not advocating for public health or the public's health, or don't really care. It doesn't appear that they care a lot about equity and what's happening in the local community. So these are ways that the American Public Health Association and its affiliates and all of the other units of APHA, there are over 30,000 members of the American Public Health Association. So everyone's doing his or her part, moving the piece that they're engaged in, but there are state, I think you mentioned states in your question, there are state entities that are connected with the American Public Health Association that if you're not already connected with, check the American Public Health Association's website and connect with that entity in your state doing the work.
Philip, do you have a response?
I mean, so I am not a lobbyist, so I'm going to make that very clear. So I don't want to get in trouble with the lobbyists from the AMC that are listening right now. But I will say, one of the ways that I, as a scientist in the center, try to contribute to this conversation is to think about the evidence, right? That individuals, that politicians would need to make choices, to make votes, to cast votes that would actually create that health opportunity. So, if we put out a research brief on the benefit for maternal mental health equity of having a paid parental leave policy, right? Our AAMC kind of lobbyists aren't going to go start lobbying or advocating for paid parental leave. That's not in the bailiwick. But many other advocates are using our research, are using our information and our data to kind of agitate and advocate at local and state levels for the kinds of policies that open up that health opportunity. So I think there are so many different ways to kind of influence political decisions and political movements. And so I think, direct advocacy and lobbying is one way, creating that evidence base and doing so in a strategic way that makes sure that the metrics that you're using or the data points that you're providing actually speak to many different audiences. I think one of the things that, and maybe Elle and Anique would disagree, I don't think that our health equity community has been really great at broadening our tent. And so I think part of my scientific imperative is to find ways to talk about equity, to quantify equity, to make the case for equity in ways that actually invite people in to build a movement, as opposed to just kind of happily yelling our truth at each other, which I think we're pretty good at. But that's not really building the movement, I think, that I've heard my colleagues up here speak about.
Right. And I think even when you think about, I'm always on that kick about defining, to help people even understand what equity is, because we talk about it a lot. And I don't know if we break it down or define it for folk enough to understand, because remember early on, we were really talking a lot about equality. We wanted equality for everybody. And then we realized that, it wasn't really equality what we needed. We needed equity. Not everybody needs the same amount of whatever, right? So helping people understand what equity is and how it plays out in our lives might even help some folk want to get on and join the movement.
Ella, just on that point, you just sparked a memory for me, and this may be going back 2 or 3 years, when kind of the anti-equity, anti-woke conversation really started in earnest. One of the things that's so important to me is that just what you said, that I think our movement is about equality of opportunity, right? Making sure every community has a real, like authentic, easily accessible opportunity for all the different things that contribute to health. But going back to politics around this, I remember reading, this is back in 2020, 2021, three or four, let's say, thought leaders in the political arena who maybe aren't working with us in the same direction at this stage, saying
Mhm.
that our work around health equity and the political spin on this was inherently un-American, this is a
Mm.
quote, right? Because we were demanding equality of outcomes, that we wanted every community to be just as healthy as everyone else. And if that meant making community be less healthy, to
Mm.
make it equal with, so they were actually saying in a land of opportunity, the health equity folks are un-American because they're not focused on opportunity, they're focused on outcomes. And I think there's some genius, right, in using our own goal, which is equal opportunity, right? That fair and just opportunity for health that's baked into our definition. And so I think part of the politics game is being equally clever and not allowing kind of our
Right.
own strengths to be co-opted and twisted in a way that actually divides the movement as opposed to bringing folks in. You just sparked that memory for me, being
Absolutely.
infuriated reading those op-eds at the
Yeah.
start of the pandemic.
And I think, just from my perspective, that health equity is something that's also not really taught to physicians. It's not something on a larger scale, like in medical education before these past few years has been a central focus of what physicians were supposed to be doing. So a lot of times physicians be looking at their individual cases, maybe outcomes for their specialty or for their sort of specific interests of what they're practicing in. But one of the things that I have chosen to do with my career as an educator is really talk about and have that be baked into the learning of the people that are working with me and around me. Is that really it's about, are we working to help the patient or the larger groups of patients achieve their best healthcare outcomes while accounting for these differences, these inequities? Are we doing that? Are you aware of what they are? If you're not, here's some information, because those things are not built into medical education nor standard medical practice. And so part of us talking about the policy, we really need to talk about what happens if somebody's sick, or if you're going to a hospital or going to a doctor's office. Are the people that are taking care of you in full awareness of what
Right.
health equity actually means and how to get you there? And are they accounting for differences?
Right.
Anik, you educate me, so I'm not a physician, but I'm so
Oh,
interested. I feel like social histories, right, have been taken for forever, right? That's always
yeah.
been a part of practice. So kind of embedding the socio-political context for a patient and family in that history, it just makes the healthcare like work, right?
Yeah.
Absolutely.
Because if you don't take that into account, how does the healthcare work? So even if the intervention, right, even I think we all agree, health equity is a kind of structural policy thing. It's not going to be achieved doctor patient by doctor patient. But
Mhm.
if on that individual level, you're not wrapping around and aware of and kind of shifting the care you provide around that patient and family context,
Right.
at worst, you're standing in the way of equity, and at best, you're kind of just not doing anything about it at all.
Right. And then how can you identify ways, again, for the medical community to now start to advocate for these
Right.
larger policy changes if you're not seeing them in the day-to-day work? So all of these things are connected to each other.
Right.
So I always kind of feel like it's important to do the aspect of it that speaks to you, but it's important to think that they're all connected.
Right.
I wanted to ask about communication, since you all talked about community. Well, first, this question was prompted by what Philip was saying about community and everybody having to work together. But clearly, to do that, you have to be able to communicate with people, and you have to convince people, like Ella was saying, that we need equity, not just equality. And Anik, you were just explaining how we have to teach our medical students and healthcare providers about this and think about it from a larger context. How do you all think about how to communicate? I was
Mhm.
asking about TikTok because that is how young people learn how they are engaged in politics these days, right? It's not the traditional pick up a landline to answer a polling question. They're on TikTok. I'm on Twitter too much, but like this is how do you all think about communicating with your peers, your colleagues, and with other people to get political change? What does that look like for you?
So I think for me, it definitely means knowing your peers, knowing the folk that you need to communicate with, and utilizing all of the avenues that you need to utilize. Because I don't do TikTok. And if you were going to communicate with me, I'd miss it, right? So it would mean that if it's a snail mail, you do that. If it's a phone call, if it's a text, if it's email, whatever you need to do, Facebook, whatever you need to do to connect with the group that you are working with, then you need to first of all know how they need to be communicated with and understand that, when we talk about communication, sometimes we talk about that one-way street, not even realizing that, if you're sharing information, there needs to be information sharing. Otherwise, you could be just talking to uh, deaf ears, right? Um, we have to find a way to acknowledge, or for people to acknowledge that they get the message, they understand. For me, that's communication, that bi-directional conversation, right? I hear you. Is this what I heard you to say? I understood you to say this, whatever. But recognize, and I think many of our institutions, especially after COVID, are recognizing that communication wasn't great.
Mhm.
However we got there, however it happened, like it happened, it wasn't great. And I give them kudos for now circling back and asking questions, listening more now, right? So yeah.
There's a question in the chat that I would probably bridge to this conversation. It says we will never achieve health equity if we don't separate it from social equity and equality. There is a business model for health equity. Look at COVID and how health inequities impacted the world and health in the financial world, the workforce. This gets us out of political bias. I would flip that and maybe think about the political model, the politics of
Mm-hmm.
health equity, right? Like for some people, it's politically advantageous to maintain inequity, right? Um, how do you all think about addressing that issue that for some people it's politically advantageous to maintain inequities? And so if our goal is to achieve equity or to advance equity, what do we do with that fact?
Wow.
Or even do you think it's a fact? Because that's what I said. But yeah, what do you all?
Uh, it's a fact. And I'll be one of the first to say, I honestly don't know, because it's even hard for me to wrap my head around the fact that there are actually people who would love to see folks stay in the um, inequitable situations that they're in, that they, in my opinion, it appears they don't care about folks. It's hard for me to, I just don't know how I guess we've always been that way, some of us. I don't know. I don't know how we deal with that, because they're digging in and going deeper with it. And it's almost like being able to say, we know that this is Black, but if I say it's white, it's white. If I say it's white, and I don't have to talk about it anymore. I don't know how you reach people like
I wish I had a direct answer, but I think you're right. There are folks, a very small number of folks, I would say, that politically and economically benefit from the structures and the systems as they are. And I think that the strategy used by those folks, because I really do believe, I wouldn't have been in this kind of health equity space for 25 years if I didn't truly believe that it benefits all of us, that the
yeah.
entire nation, the entire world will benefit if we all, no matter what our community looks like and who lives there, if we all had a fair and just opportunity for health. So let's
Right.
say it benefits 99.99%, and we're talking about that 0.01%
Mm.
that is in power, right? Because it really does come back to power. And I think
Mm.
about what strategy they use to make sure the 99.99% of us don't come together,
Mm.
right? And it is purposeful division.
Yeah.
It is purposeful. And so how do we counter purposeful division? And I think, Ella, you really started, you talked about bidirectionality, you talked about listening, about communication. I think of the core principles of community engagement, right? So if we think our community is 99.99% of us, then what are those core principles in that beautiful kind of National Academies model that was published a couple of years ago? So bidirectionality is there, trustworthiness,
Yep.
co-created, shared governance,
Yes.
right?
Yes.
Inclusive,
Yes.
equitably financed. So et cetera, and there are others that I'm sure I'm forgetting. So I think for those of us that are helping lead the charge around this health equity movement, it is time for us to walk that talk of community engagement, of authentic, active, deep listening and adjustment based on what we're learning and hearing with communities that are not our natural allies in that 99.99%. Because until we do that, the strategy of that 0.01% of divide us all up so our votes don't add up, so our voices don't add up, so there's no counterbalance to the unbelievable power that is
Yeah.
wielded by that 0.01%. So we need to figure out if they're dividing, we need to multiply. And I think that is, in my mind, that is shoe leather on the ground, community engagement, partnership, even with uncomfortable bedfellows. I think until we get comfortable with that discomfort, we can't galvanize the movement we need to counterbalance those political forces. So,
And I would add to that, Philip, sort of very well said. I think that complacency is something that's very easy to just stick with, especially if you're a part of the group that's sort of benefiting. Things aren't really going bad for you. You understand that things are inequitable for other people, but you know what? For the most part, I'm doing what I need to do and I'm okay, or the people around me are okay, and really attaching emotion around this idea of our shared humanity and how it's so important for us to really be concerned as a group with why certain people aren't getting what they should be getting or to the best of our abilities. Because again, that complacency will let us think, hey, it's all right, it's working. And that's how structures remain. And so in order for things to change, people really have to get some emotional energy around the idea that our shared humanity, we're not living up to its ideals and we need to do something different, even if it doesn't directly affect you, which is sort of goes against our culture a little bit. But it's something that's critical to advancing what we're talking about today.
Yeah.
I think it goes against our culture a lot. Right.
Mhm.
So yeah, not a little bit, a lot. So
A lot.
I'm agreeing with what you're saying. I'm also bringing it back to the audience. You all don't know how this conversation got started, but it got started in one of our National Advisory Committee meetings, and someone brought up, how do we go forward in doing health equity work in a changing political climate? So we are in an election year and have been in recently election. I live in Louisiana. Elections have consequences literally to our health. There's just been an article published about how doctors are delaying some prenatal care because they're afraid of being getting in trouble in Louisiana for potentially doing abortion care. So this is real life, right? And so we're in an election year. And so I'm wondering how you all are thinking about how we continue to do health equity work, how it might change how we do it in a changing political reality that could or could not happen. We don't know. But yeah, how are you all thinking about that?
As a physician, I really think about this a lot. And I think part of it is organization. Like if I am an individual practitioner in a state where the political climate is tense, or I'm being told the laws have changed which directly affect my patient care, if I just think that I have to deal with this by myself, nothing's going to happen. And so I think that physicians have to organize and really be specific and intentional around organization, because ultimately the healthcare can't be delivered without us. Regardless of what the law says, you can't do anything without us. And so I think what has happened, back to Philip's point about engagement, and talking about more about the community, but what's happened in our fields, respectively in medicine, is that we've sort of been so individualized, so limited to our practices, that we forget that there's a larger body of organizations that can represent us and that we need to get active. And I think that if I'm a practitioner working in a state where sort of like the bread and butter of my day-to-day practice is being affected by laws, I'm not doing anything. And I understand the care of the patients, but again, thinking about when we're talking about equity, I can't just say I'm going to take care of this set of patients while I know for sure that this other set of patients won't get care, won't be able to access the things that they need. I can't do that. And so organization and bodies of organizations need to get active. And I think, unfortunately, large medical organizations, I don't think have been as active as they should have been, given all of the changes and how fast the changes have happened, especially since the Dobbs decision.
And I think, this work, we all know that has a long arc, right? We are talking about generational change. And so one of the things that I think we could start doing in service of this election cycle and others, I think we need to start engaging youth in a different way, and youth power in a different way. So we do a lot of public opinion polling at our center, and we did a Generation Z kind of oversample. And I'll just share like one thing that really surprised me in a good way. So 75% of self-identified conservative members of Generation Z said healthcare was a human right and that the federal government had an obligation to provide healthcare to everyone living here. That's 75% of conservative members of Generation Z. And there are all these other overlaps where we think there's such partisan divides, and maybe, and there certainly are, down the street from where I am in DC. But I think engaging youth and leaning into those areas of overlap and finding a consensus agenda for health equity. Maybe I don't know if this is true, but maybe, gun violence isn't the place to start. But maybe healthcare is, right? Maybe educational funding is. What are those places where the folks coming up behind us already agree in a bipartisan or nonpartisan way? And how do we actually engage and galvanize them in service of a health equity agenda that they can get behind across party lines or across ideologies?
Absolutely, I agree. And even thinking about the younger folk, to be able to listen, to hear what they're saying. They might not know how or want to understand how to do things the way we've done it, or they might not the way we've done it. But to put ourselves in a position where we're willing to listen and bring them along, or step aside sometimes and put them up front, allow them to lead. Sometimes we have issues with moving out of the way. And so to go ahead and continue the work, because the passion is there. We have to continue the work. We've got to continue the movement, right? But we still have to reach back and pull others in and make sure that we're making space for those folk and understanding that their struggle might not be our struggle. And we have to listen and understand how to deal with their struggles as well.
I have a couple of questions in the Q&A that are out, sort of ask them more broadly. One asked about how do you deal with colleagues, other people who are not, who have a difficult time. Let me rephrase that. How do you deal with colleagues, people that you work with who are unwilling or are not in agreement with your stances, your political stances related to health equity and healthcare? And this can range, from what we're currently seeing in Gaza and healthcare, as well as this concept of public health during war and violence. It can also range, I think about my work related to racism and how people do not want to talk about it. They'll say racism, if they'll say it, they'll say racism is a public health crisis, but we don't go any farther beyond that.
Right.
You all think about how to deal with people colleagues, even people who are saying that they're committed to health equity, but do not want to either talk about or make those changes that are necessary, politically necessary, to advance toward health equity?
I can say that it really depends on your individual power, the power that you can assemble around you where you are, because a lot of these conversations can get dangerous. And we've seen recently that people are falling victim and being pushed out, specifically Black women, out of these spaces. And so like, number one, I would say, let's use our common sense. Let's take a inventory and let's see what the power looks like and try to gather people around you who have maybe more influence or more power than you to kind of move towards a common goal. But I think that there's also like, you have to understand who it could be willing to have conversation and who's not willing. I
Yeah.
think part of it is like, a lot of times people are like, well, you should know this, we're in this and we should all agree. And the truth is we don't. And there are a lot of people who do not want to talk about racism, sexism, all the isms. They don't want to discuss it. They don't want to have it be a part of what we're doing. And so I think that people have to like, you have to start with the people that are willing to have those conversations with you and are willing to work with you. But if the person is not, that is up to the larger group or the organization itself to kind of see, who are we? What is it that we want to represent? And having these people that are unwilling to engage or sort of not willing to talk about equity and all the other things that are associated with it, does this represent who we are? And I think that's where organizations have failed us. It's because they're not willing to do that. They're just trying to say, this is not us and this is what we represent. They put nice statements out, but they're not willing to live up to by examining who is a part of the organization. And are they willing to engage in the work and moving the work forward or not?
And if you find yourself in a situation where you are in an organization where you don't have that kind of support, or you can't really have those conversations, then look outside of that organization, but find folk that you can talk to that will help you navigate through that process. Because if it's not going to happen on the job, it's not going to happen. And you could be in danger, but find someone even outside of the job that share your thoughts and want to move in the same way that you're moving, because those people do exist.
Okay, first of all, I want to thank everybody, especially our participants, for just keeping the chat popping. Y'all have been very engaged, very good questions. I will ask if there are any closing, maybe not even thoughts, but things that you all, somebody put in the chat about a program for people to become civically engaged. If you all have any thoughts or recommendations on how individuals or organizations can become more politically involved toward advancing health equity?
Oh, wow. Well, just off the cuff, I would say, because I know that the work that APHA does touches on being politically involved. I would say join APHA, join us. There's plenty of work being done at the national level. There's plenty of work being done in the different cities, the affiliates across the states. So just look for folk who are like-minded, who are working on some of the same issues that you're working on. And, you know, I know they would love to help guide you through the process, to connect you in a way that would be beneficial for you and the work that you're doing. But yeah, consider joining.
And on that same shameless plug tip, I'll do the same thing. Thank you, Ella, for our Center for Health Justice. We convene a 1,500 person and growing strong collaborative for health equity. They are our first stop. So it's about half of folks from medicine, the other half are community partners, public health partners, business partners, government partners, et cetera. And we co-create everything we do with Charge. So our comment letters, our developing our research agenda, our policy analyses, our polling briefs. So there's a really direct way to get involved in the work of the center. It's free to join, anyone can do it. So check it out. I'll drop a link in the chat.
Yeah, and I would just say, because I know this is a broad audience, talking specifically from the medical sort of societies and organizations, try to find groups that are already working on areas of advocacy that you are interested in, and that are dealing with topics that are central to what you think is important. And join them, be active, become a part of them, because I think it's so critical. And health equity cannot happen without physician involvement and engagement.
And I will say vote and organize. I will also say thank you to our
Yes.
panelists. And I will also say I think that we need a part 2 for this discussion.
Yes.
The time went by too fast, so I am looking at our staff to say, yeah, we need to extend this conversation. Thank you all so much. We really appreciate it.
Thank you, guys.
Thank
you.
you.
It's been great.
Okay, so we'd like to hear from you about how practical and applicable the conversation we've had today is or was. So we'd like to invite you to fill out a short survey that you should be able to access through a link in the chat or by scanning the QR code that you are seeing on your screen. We are going to conclude our session today and invite you to join us on April 16th for our next webinar titled Anti-Racism and Health Equity. I'm sure that we can connect some of the things that we talked about today to that webinar. Stay tuned for our next workshop series coming early summer. Please also stay tuned for our new podcast episodes, which will be dropping between April and July. More information about our upcoming activities is available on our website. Follow us on social media and help us spread the word by sharing our content that most interests you in your work. See you soon.